Abhishek, you can start the program now.
Okay, sir. Namaste, good evening, and welcome on all. Today, Ziksha Ayurvedic Learning Series of I Ask Ayush presents you the topic of significance of Anupana in diet and drug by Dr. Vipan Saraswat. Before that, I like to say a small story about I Ask Ayush. I Ask Ayush represents the upliftment of Indian medicine. On the successful journey of 3 years, we conduct seminars on exciting topics with innovative speakers on every Sundays. Sundays, at 6 p.m. we conduct seminars on such as elaboration of Samhitas, simplification of Sanskrit, and also clinical experiences of many Ayurvedic big shots. We also represent that we also do the seminars on Saturdays in our native language of Tamil, that is on the series named Anaivarukkum Arogyam. Currently, we are with the clinical experience of Dr. L. Mahadevan Iyer. Dr. L. Mahadevan Iyer is sharing his 23 years of clinical experience on clinical nephrology, which is held on October 7th, October 14th, and also previously September 30th. Candidates who are interested can register as soon as possible, and there is no worries about the past September 30th program. Candidates who are registering now can have the recorded video session after October 7th and October 14th. So kindly utilize it. Then let's see about this session. Dr. Vipan Saraswat. He has completed his BAMS at State Ayurveda College, Bareilly, and Sir has completed his MD Dravya at National Institute of Ayurveda, Jaipur, which is a dream college for many Ayurvedic students. Sir has also published many papers such as importance of diet and method of its ingestion, prakriti, diuretic activity of aqueous and ethanolic solatidine, concept analysis on Shukravas and many more. Sir has also attended many national and international conferences on topics such as hypertension, obesity, Vatikarana, diabetes, and many more. So let's not get into late and let's get into the session. Over to you, sir.
Okay, sir. Thank you very much. Okay, sir. Thank you very, very much. You provide me this opportunity. Let's. I'm starting my article, my topics. Significance of Anupana in diet and drug. First of all we know today is the 2nd October. This day, the birth anniversary of Mahatma Gandhi and Pandit Lal Bahadur Shastri. So first of all, I give you बहुत बहुत शुभकामनाएं गांधी जयंती की हम सबको बहुत बहुत शुभकामनाएं. Now start the topic. Topic is significance of Anupana in diet and drug. Basically, I am a Dravigun scholar, but I have a lots of interest in Sahitaj. When I am completing my PG from National Institute of Ayurveda Jaipur, and I written this article, I have some general knowledge about the Anupana. After joining as a medical officer in government of Uttar Pradesh, I understand this article very well. So today I discuss some practical applicability of this article, significance of Anupana in diet and drug. Now let's start the article. Some general things. Ayurveda is the indigenous system of medicine in which so many drugs are used for preventing and cure the disease. According to Ayurveda, disease are manifested by the vitiated dosas. So to grow up as healthy individual, it is necessary to keep dosage in some means equilibrium. For this samya or equilibrium, Ayurveda describe two type of treatment. Now, first of all, what is the treatment? All we know, यावि क्रिया जायन्ते शरीरे धातव समा स चिकित्सा विकाराणाम कर्म विषयम स्मृतम. ठीक है. तो any treatment which is indicated for the equilibrium of dosage or equilibrium of dhatu is indicated as treatment. Acharya Charak also described two type of chikitsa. What is this? This is the Urjaskar and Rogunat. Urjaskar means the treatment indicated for the improvement of immunity. And what is the means of Rogunat? It is the type of treatment which some the diseases, and it include two type of procedure. One is the sodhan, second is the saman. What is the sodhan? The procedure by which dosas expelled out from the body, and it is the vasti, vaman, virechan, and nasya and raktamochan. And what is the sansaman chikitsa? The process by which dosa get samya inside the body. So in this type of treatment, drug administered inside the body or outside. Inside the body in the form of vati, avaliha, gutika, churn, or outside the body in the form of lep or upna. So in saman chikitsa, drug is administered along with the proper anupan to pacify the dosas. Now, what is the anupan? So one more slok about Anupan by Himadri. They told, Anupaschat sabha piyate iti anupanam. Means, according to Susrut, the one which is taken along with or after the meal is called anupan. And also by the Admal, commentator of Sarangar Saita, told, any liquid medium which is used after administering the drug or along with the drug is known as the anupanan. Here we see there is some difference between the Admal and the Susrut. According to Susrut, the one means they not indicated the types of anupan, like as it may be liquid, it may be semi-liquid, or it may be solid. But according to Admal, it is clearly indicated the liquid medium which is used after the administering the drug or along with the drug is known as anupan. Why it is taken anupan? Why we taken anupan? हम अनुपान क्यों लेते हैं? तो नाउ वन मोर श्लोक, यथा जल गत तैलम छड़े नैवम प्रसरपति तथा भैषजम अंगेषु प्रसरपति अनुपानतः. Means the anupan is claimed to distribute the drug throughout the body within no time. It spread like oil drop on water, which spread in all directions fastly. So the anupan help in the quick absorption, distribution of the drug. In modern system of medicine, the term anupan may be taken for vehicle, adjuvant, or carrier, through which the action like the drug absorption, drug interaction are performed. So now let more things in allopathy, modern medicine. According to Tabor's Cyclopedic Medicinal Dictionary, the meaning of these three words, which are vehicles, adjuvant, and carrier. Now, what is the vehicle? And what is the meaning of vehicle? The vehicle is an inert agent that carries the active ingredient of the medicine. And now, what is the adjuvant? Adjuvant is that which assists, especially a drug addict to a prescription, to hasten or increase the action of a principal ingredient. Now, what is the carrier? Carrier is the molecule that, when combined with the another substance, facilitate it to pass through the cell membrane, as occur in the facilitated diffusion and some other transport mechanism. Now, what is the importance of anupan? First of all, we discuss about Anupan. Let's we know what is the Dravya. Well, we know the Dravya, we well understand what is the Anupan. After all, Anupan is a Dravya which is taken along with meal or after with the meal. So what is the Dravya? According to Charaka, Yatra Sita Karmangura Karanam Samvayatta Dravyam. It is the basic slok we all know about this. Means the substance which have the excellent properties in inherent form is known as Dravya. In this slok, we let's focus on this slok. What is the meaning of good in this slok? What is the meaning of good in this slok? Good means good sabden che dharmavachana रस वीर विपाक सर प्रभाव सर्वैव गृह्णन्ते. It means it shows the pharmacological property by which Dravya is acted. So that term good is used for this slok is a pharmacological properties, and karm it is a pharmacological action. So now what is the importance of Anupan? Properties and action reside in the Dravya in inherent form. By having the knowledge of its property, the Dravya can be administered appropriately. So, according to Acharya Charaka, Anupanam hitam yuktam tarpatyasu manavam sukham pachati aharam mayesu cha balayacha. Means the meal taking with a suitable Anupan get easily digested and provide good quality of life. Good quality of life means it provide well, क्या कहेंगे, बल and आयु, ठीक है, age. Now let's other importance of Anupan ya by means Bhagavad. It provide it is Tarpyati means refreshing. It is Prinyati means pleasing. Urjyati provide energy. Banhati dehasya means it nursing the body properly. Paryaptamim vinvartyati yuktam bhuktam avsadhyati means it brings satisfaction and steadiness in the food consumed. Anasangat virakti, it help in breakdown of food particles. Mardab apadyati, it soften the food. Klidyati, bring chiryati, help in the proper digestion of the food. Rochanam, it improve the taste. Vrasya, improve the potency of the drug. Sramahar, it relieve the fatigue. Vipan, it also act as a appetizer. Dosancham samanam, elevate the dosage. Varnakar, improve the complexion, and Tarpatikar, it bring the satisfaction. So these are the importance of Anupan, which is mentioned in text, various classical texts. Now, what is the properties of Anupan? The Anupan which we have taken, what properties which have? Yeah, what is the property which is important from which is importance which have the importance in Anupanam Dravya? So now Vipritam Yadannasya Gune Syad Virodhi cha Anupanam Samasenam Sarvadatat Prasasyate means Anupan have the properties opposite to the properties of Ahar Dravya, but not the properties the opposite of Dhatus. Means Anupan which have the properties opposite to the Ahar Dravya, like as we taking the meal which have the Snigdugun, so that it is the necessary, yeah, it is the important that Anupan Dravya have the property opposite to the Snigd Dravya, like as it is the Usna, it is the Ruch, so the Anupan Dravya have the property opposite to the Ahar Dravya. Now some other important indications, contraindications of Anupan. Now, what is the contraindications of Anupan? The contraindications of Anupan are in two types. There are two ways. First, contraindications of Anupan in some disease, and the contraindications, some action contraindicated after the Anupanan. In reference to RP Yogi Anupan means in reference to the Anupan which is taken after the meal, various contraindications have been enumerated in the ancient texts. Therefore, caution should be taken in the people with following conditions, like as Swas Krachata, difficulty in breathing, Kas, cough, disease above the clavicle means Udrajatrugat Rog, and Swarbed means hoarseness of the voice. These are the some examples of the disease in which we take some cautions to take the Anupan. Now, what happens if we taken the Anupan? If in these situation we take the Anupan, some problems can be happens according to Bhagavata. If the anupan is given in above condition, it causes the asadusti. It diminishes the agni by avisyant property of the snare, which is located in uru and kant, and cause woman-like disorder. So it is necessary. First, we carefully examine the patient, and after that, first we carefully examine the patient or healthy individuals. After that, we indicate is which different type of anupan in the healthy person or in disease patient. The action contraindicated after the anupan. After the use of anupan, the person should not include the following activities like a journey, yatra nahi karni hai. Second is exercise. Third is too much study, too much talk, too much sleep, and too much singing. These are the some specific activities which is avoidable after the taking of anupan. Now, disadvantage of not taking anupan. If we not taking proper anupan, what can happen? Yeah, some activities which can happen if we not taking the proper anupan. If anupan is not taken in described form, then the solid food which is taken will not mix the liquid portion, remains without any movement and cause disorder. Hence, proper anupan should be used after the meal. Now, important things, one more important things, types of anupan. So, after we discuss, after saying all the discussion, anupan can be divided in two types. First is ahara piyogi anupan, and second one is ausat piyogi anupan. Now, what is the ahara piyogi anupan? The anupan in the context of meal or ahar. Means the anupan which is taken after the ahar or meal is called ahar piyogi anupan. And now second one is ausat piyogi anupan. The anupan in the context of ausat, seven or medicine. Means the anupan which is taken after the meal, after the medicine is called ausat piyogi anupan. Now what is the ahar piyogi anupan? The anupan in the context of ahar seven. I already told you the anupan which is taken after the meal is called ahar piyogi anupan. It is divided in the three categories: adipan, madhyapan, and antapan. Adipan, madhyapan, and antapan. What is the meaning of adipan, madhyapan, and antapan? Adi means prior to the food. Madhya means with the food or in the middle of the food, and antapan after taking the meal. So now first all we discuss what is the adipan. Adipan, the anupan to be taken prior to the meal is called adipan. Meal means time bhojan. The importance of adipan is that it causes the krishta to the healthy individual. So the patient of stol and other medo vriddhi disorder can be taken anupan in the prior to the meal. In daily routine of the practice or in the OP, my dispensary practice, lots of patients come with this type of problem. They are overweight and they want some prescription about their obesity. So now this is a important form of anupan. We told the patient you take the anupan in prior of the meal. Now second is madhyapan. The anupan to be taken during or in between the meal is called a madhyapan. And what is the importance of madhyapan? The importance of madhyapan is that it helps in the maintenance of body. So it is indicated in the swasth purush. Taken of the swasth purush. Now what is the antapan? The anupan to be taken after the meal. And it is also a special types of anupan. What is the importance of antapan? The importance of antapan is that it causes the brahan. So it is indicated in the patient of Karse. For that, इसीलिए I told you it is the specific type of anupan. In the daily routine of practice, I have lots of patients. They want some gain the fat. So we can told that we can say that you take the anupan after the meal. Now, what is the ausat piyogi anupan? Ausat piyogi anupan. It is very, very important. and in daily routine of practice, or in my uh, OPD practice. I am a government medical officer, and daily I deal approximately 50-60 patients. I use this type of Anupan regularly. Later I am discuss how I will use this type of Anupan. Anupan taken after or along with the basis serve as Ausatpyogi Anupan, and this important functions of this Anupan, uh, important function of Anupans like as easy intake of drug. Second one, increase drug palatability by improving taste, consistency, and by masking the order of the drug. Very important role of this Anupan in the Ausat Sevan. Anupan may act as adjuvant to drug in treating the disease. Lots of patients, they are complaining with diarrhea. I prescribed Kotaj Ghanabati. They told me, sir, some single tablet is not necessary. So I prescribe Kotaj Ghanabati with the Kotajarist. So in we saw, yeah, I want to indicate at this point because I am increasing the uh, potency of the drug. Anupan may act as adjuvant to the drug in treating the disease. Anupan may mask or reduce the side effect of the drug. In the properties of Anupan, I already discussed you. What is the property of Anupan? It is the property of Anupan is opposed to the properties of Ahar Dravya, not the opposed dhatus. ठीक है, like as we taking snigdh Anupan and like as we taking the snigdh ahar, we give them ushnavir dravya in the form of Anupan. By the proper use of Anupan, drug quickly distribute in the body. It help the drug to reach the target site. So I told you it is basically it is a daily use type of Anupan, and we use in daily practice. Now the importance of fundamental choosing Anupan. Now important fundamentals choosing Anupan for a disease. There are some basics kept in the mind when we choosing the Anupan, and these are on the basis of dosage, on the basis of disease, on the basis of patient, on the basis of drugs, on the basis of diet, and on the basis of time of call. So that these are some important factors which kept in the mind during choosing the Anupan. Dosage, disease, patient, drugs, diet, and time and call. Dosage is very important factor in choosing the Anupan. How? Let's discuss Anupan according to dosage. According to Acharya Saraswat, isnik dosram marte pathe kafe ruchosn mishyate anupanam hitam chapi pitte madhuram shitalam. Anupan indicated in Vataroga. या वातिक dosa. The Anupan indicated in Vat Rogas has the property like an Snigdh and Usn. Why Anupan have the property like as Snigdh and Usn? Because Vat have the property like as Rucha, Sito, Laghu, Susmach, Lota, Vishadakhara. So the property of Anupan in opposite to the Vat dosa. So the Anupan indicated in Vat Roga has the property like as Snigdh and Usnagun, because the property of Vat or Ruch, Sit, etc. are described by the acharyas. Now, what is the Anupan indicated in Kapha Roga? The Anupan indicated in Kapha Roga has the properties like and Ruch and Usn. I already told you that the property of Anupan is opposite of the dosage. So the Anupan indicated in the Kapha Roga has the property like as Ruch and Usn, because the properties of Kapha are Snigdh and Sit mentioned by acharyas. Now Anupan indicated in Pitta Roga. Anupan, we all know Pitta have the properties like as Amla and Usna. So the Anupan used in peptic disorder or peptic diseases should have the properties of Madhur and Sitvir. Now let us discuss Sit. So it is the Anupan indicated in Pitta Roga has the properties like the Madhur and Sit, because the properties of Pitta are Amla and Usna. Acharya Charak also indicated Anupan Dravya in according to dosage, like as Vat dosage. It is the Sura, types of alcohol, citrus food, Tosodaks, Pitta dosage, Amlaki, Yasti Madhu, milk, And in kapha dosas, it is the madhu and cow urine. As we seen, vata dosas, the dravya are usna, like as usna properties, and in pitta dosas, dravya are madhur and sheath, and in kapha dosas, dravyas are ruch in properties. So the dravya indicated for the anupan are the opposite of dosas. Now the quantity of anupan according to the dosas. In Sadhana Saita, the quantity of anupan is also indicated. In Sadhana Saita, the quantity of anupan for churn, avle, gutika means powder, linctus, and tablets is mentioned according to the dosage vikar. Now in Vataj Rogas, the quantity of anupan is 120 ml. Pitta Rogas, it is 80 ml, and in Kaphaj Rogas, it is 40 ml. So it is another important factor. When we decide the quantity of anupan, in which quantity we prescribed anupan for a patient, so it is be mentioned in the Sarandar Sanhita on the basis of disease. Next and most important factor of the anupan on the basis of disease, because in daily practice we regularly see that different types of patient, and we indicated the different types of disease, different type of drug, and different type of anupan. In Vaidyak Jeevan, Charak Sanhita, Susru Sanhita, and Yog Ratnakar, anupan according to the disease have been listed. These substances are drug themselves. Now, second most point is that these substances are drugs themselves. Means that substance indicated in the anupan are also a drug. These substances are drugs themselves and act synergistically when used as anupan with the main drug. Means the meaning of this point is that anupan is already a drug. I told you anupan already a drug, and what is the property of a drug according to Charaka. So when anupan add with the main drug, it can increase or hasten the effect of the main drug. So now the some important example, which is different which is mentioned in different Sanhitas. Kshay Rog. In Kshay Rog, we indicated the Masras. If we remember, Acharya Charak has mentioned Masras Bhadiyadam. Masras is the important drug for brain, ज्वर and fever. ज्वर में अगर हम if we want to use anupan in ज्वर, we use chiraita. Grahini disorder, takra and takrarist. Krimi rog, vidang. Acharya Charak is also mentioned. Vidango, kramignanam. Ars in hemorrhoids, chitrak. Why we use chitrak as anupan? Because all we know, the main cause of ars or hemorrhoids is mandagni. If we want to increase or maintain the agni, we use chitrak. Chitrak is usnugunin property and is directly increase the agni. Next is pandu or anemia. Anupan is mandur bhasm. We also prescribe the patient in the form of lohasa. Now next one is prameha or diabetes. Amla ki swaras mixed with the haridrachun. Haridrachun mixed in amla ki swaras, then we indicated as a anupan in the diabetes or prameha roga. Next is vatrakta or gout. Important drabya, guduchi swaras. Lots of patient I have treated this formulations only and only with guduchi swaras. Next, pradar roga. Important anupan, lodrasa. Lodr act as a kasai, lodr act as a grahi or stamban drabya. Or in pradar rog, we indicated lodrasa due to its that property. Next is switra or vitiligo, bakuchi fruits. And then last one is atisa or diarrhea. We indicated kutaj as a anupan. I already told you when I prescribe patient kutaj gravity, single tablet, and I suggest they take this tablet with kutajarist, and they get ultimate result. Next, on the basis of the drug. On the basis of the drug, yes, if patient taking the ghatpan, we used take usnajal patient taking tel, we recommend Yushpan, and a patient taking Vasa or Majjapan, we advise Mand as a Anupan. Next, on the basis of patient. Next another important factor for Anupan. Krish patient. In daily practice, we see in lots of the Krish patient, lean and thin patient, they want some Medo Bradhi, ya Brahan Gun, prescribe Sura as the form of Anupana. So why Sura? Because it the teach to good or etc. good, it act as a Sroto Sodan or Anloman Gun and act as ultimate in the form of Anupana. Stool patient, we advise Madhudak as a Anupana. And on the basis of time and call, important factor, because we see Greece and Sarad Ritu, it should be take Sital Jal. Because these both Ritu are responsible for aggravating the Pitta dosa. So to keep manage the Pitta dosa, we take Anupan as a Sital Jal, and in the Hemant Ritu, we take Ushna Jal as a Anupan. Why in Ushna Jal? Because in Hemant Ritu, Kapha is an aggravating factor. To manage the Kapha dose, we take hot water or Ushna Jal as a Anupan. Now last one is, thank you, sir. Thank you very much. You give me this opportunity. I share my views about Anupan to you.
Thank you. Thank you for the wonderful session.
Thank you, sir. Thank you very much.
Let's go and get into the question session, sir.
Ji, sir.
Sir, can we move into the question session, sir?
Yes, sir. Okay, sir. Okay, I am ready, sir.
Sir, they have saw that Anupana is contraindicated in Swara Veda. I know the reason, sir, why it is contraindicated, sir.
Sir, I think because it is a type of Kapha disorder. So, we take the Anupana in Ayurveda according to the history of Kapha dosa, it may be mentioned as a contraindication of Anupana.
Okay, thank you, sir. Sir, then what type of Anupana we can prescribe in Vata Kapha disease, sir?
Vata Kapha disease.
Yes, sir.
Yes, yeah. Already, sir. Good question, is it? Vata Kapha disorder, sir, we take, I think it is Ushna Unna properties, sir. Because Ushna Gud both act on Vata disorder and Kapha disorder. Both have the Seeth property. So it may be a good suggestion if we advise the patient to take Dravya which are Ushna Unna properties.
Okay, thank you, sir. Sir, can we move on to the conclusion, sir?
Yes, sir.
Okay, sir. Thank you for welcoming, sir. Thank you for coming to the session. I hope we must see once again, sir.
Yes, sir. Thank you, sir. Thank you very much. You give me this opportunity. I share my views with you and other person.
Okay, sir. Thank you, sir.
Thank you, sir. Thank you very much.
So I have to repeat that Dr. L. Mahadevan Iyer has sharing his clinical experience on clinical nephrology, which is held on October 7th and October 14th. So people who are interested can register now, and no worries about the September 30th session. it will be provided as a recorded video session. And not only this session, all the session we are doing in the, which is Anaivarkum Arogyam and also Ziksha Learning Ayurvedic Learning Series, are telecasted in both Facebook and YouTube. So kindly make use of it, and person who are interested to register in this Dr. L. Mahadevan sir experience session, kindly make a note of it. Kindly save this WhatsApp number 8110055100. I'll repeat it, 8110055100. Kindly save it and you will get notifications updated. And stay tuned. Don't miss the session, and thank you. And this session is hosted by Solai Krishnan Prakasha Abhishek from Government Ayurvedic Medical College, Nagarkoil, Tamil Nadu, and it's me. And thank you for giving me this opportunity. Thank you. Namaste. Nandri Vanakkam.
Thank you, sir. Thank you very much.
Thank you, sir.